Construction jobs are booming in Houston. A new report says we're #1, adding 13,000 new jobs in the past year. Staffing firm Robert Half International says the overall jobs picture is improving, just not at the speed we'd like it to. They offer some advice for getting ahead.
You definitely want to look at maybe consulting and or doing or accepting a temporary position that might get you your foot in the door to the right company.
Jobs may be booming, but the number of Texans without health insurance is among the highest in the nation. An estimated 800,000 Houstonians are uninsured. So are Houstonians better off this Labor Day than they were last year? That's the question that we've asked you on our Fox 26 Facebook page. We'll be reading some of your responses during our segment. Here in our newsroom, we have our legal analyst, Chris Tridico, news analyst, Mustafa Tamiz, and public policy analyst, Jackie Bally. Good morning, guys. What do you think about the overall economic picture here in the city of Houston?
Well, you know, Houston has boomed through the recession largely because of our housing market, and our construction starts have stayed up even though the housing market has dropped and fallen nationwide. But what we're not seeing is these jobs equating to the full-time positions in places where you get health insurance, and that's why you've got this huge divide among who has insurance and who doesn't. 800,000 people. Now, the Obama administration, the Obamacare is taking effect October the 1st for the open enrollment. Houston got a $7 million grant for 4 or 5 public agencies to community agencies to sign people up. Probably not enough money, Jackie Bally, to get started on this, but what's the answer? It's really not an Obamacare issue, in my view, that these people don't have insurance. It's an employer issue.
It's not an Obamacare issue. A couple of things. The sectors that are really thriving besides construction that was touched on is retail, service, and agriculture. I mean, Texas is very unique because of that. And those services or those industries rarely offer health insurance.
Historically don't.
Right. And you made a very good point, a very valid point, when you said a lot of the things that we do, how we employ a lot of people here, just don't offer insurance. Another thing is we have a very large immigration population, or non-citizens. And 1/4 of all the people who are uninsured in Texas are non-citizens. And in the country, Hispanics have the greatest percentage of those who are uninsured. So you're looking at the huge influx of immigrants. You have a lot of non-citizens who are in the workforce, and they're working at jobs that don't usually provide health care insurance. So that's what you're seeing as far as the large number that we're looking at.
And what's the answer, Mustafa Tamiz? I mean, you've got this group, this segment of the population that historically doesn't get insurance from the employers. So how do you get these people insured?
Well, it's really sad, right? We live in a town where we have the best medical center, arguably the largest and the best medical center in the world, yet nearly half of the people that live in the city of Houston don't have access to health insurance. And what we've seen at the state level, Governor Perry's blocked Medicaid expansion. 1.5 million people won't have insurance because of that. 7 million people across the state don't have health insurance. And yet we consistently block efforts to provide care. And so, you know, we've sat on this table a few times. We talk about Obamacare. We say how horrible it is. But in the end, the objective of Obamacare is to cover every single American, or at least vast majority of Americans.
And I want to go to Sally, but I want you to address the issue of Rick Perry blocking the federal funds to expand Medicare, because that is, I think, part of the issue here. But right now, let's toss to Sally. She's monitoring the Facebook and Twitter accounts.
Yeah, we'll get in a couple of our viewers' viewpoints here, and then we do want Jackie to be able to respond to that. Megan says she was laid off last July. She's been looking for a job ever since. She says, sure, there are more jobs, but they're barely pay minimum wage, and they're all part-time. And then Adriel adds that there are good-paying jobs out there, but most people can't get them because they don't have the experience employers want. And that's what we're seeing more and more, is that specialized training is really key to getting these better jobs.
And look, that's important. And we've spent the last 40 years talking in this country about the need to get a college education or more specialized training so that you can move up. I don't really have a problem with an employer saying, I want someone with skill to take on this position. That's not really the issue in my view.
Well, let's first address the first question that you and Sally had as far as Governor Perry. We had the largest number, or a large number, of uninsured before Governor Perry took office. The Medicare, particularly that question, you know, they are historically known to reject or have issues with people who have chronic illness, and a majority of those people are either seniors or women. So even if we were to say that Governor Perry made another decision, you would still have that issue, particularly in Texas. So the numbers that would change are very minimal. With Obamacare in particular, you're not going to see that much of an impact or difference whenever the law does come into effect, if it does come into effect, since nobody knows what the law is. But even if it were to come into effect, it's not going to have that much of an impact on the numbers either, again, because of the people who we have entering the workforce here in Texas. The numbers of uneducated and immigrants and non-citizens that we have, that's going to only increase. Unfortunately, a lot of these non-citizens are always also the ones who are high school dropouts, and those are the ones who are going to go to the lower level jobs.
Real quick, is the open enrollment starting October 1st going to have an impact?
Absolutely. I mean, you're going to cover more people. More people have health insurance, and it's the immigrant community that's built our city. We're a vibrant, exciting city because of the immigrant population that's here. That's helped us thrive. Our unemployment rate is 6.1%. We're doing fabulous, but we're leaving a lot of people behind.
All right, we're going to have to leave it right there. Sally, we'll be back in the next hour with two really, really good topics.
Good discussion. Thanks so much, guys. We look forward to it. And your time is 6:55. It's looking more and more likely that the White House and Congress are headed for a showdown over the nation's debt, and it could come sooner than you think. Our front page panel will be back to discuss the possibilities of a government shutdown.